Irregular periods is something that I hear from my clients all the time. Well, they can cause a whole lot of symptoms like weight gain, and the reasons can be due to stress, unhealthy lifestyles. But one of the main reasons of irregular periods is PCOS, Polycystic Ovarian Syndrome. Hi, this is Aniket, certified from International Sports Science Association. Today, we'll be addressing this topic on PCOS. Stay tuned. Now, before understanding what is PCOS, let us first dive deep into what are irregular periods. Well, if your cycle is not of 28 days, then are your periods irregular? No. Well, if your periods do not arrive at the same time, even if your cycle is of 26 or 28 days, then usually doctors will say your periods are irregular. So what causes irregular periods? Well, one of the common cause of irregular periods, apart from all the other factors, is PCOS, Polycystic Ovarian Syndrome. The name suggests there are multiple cysts present in the ovaries. Fluid-filled cysts contain immature eggs called as follicles. Now these follicles fail to release eggs. Many small sacs of fluid develop at the outer edge of the ovary, which are called as cysts. Now since the follicles fail to release eggs, ovulation does not happen and hence periods does not occur. Statistics suggests 1 in 5 women suffer from PCOS. Many are undiagnosed too. PCOS is diagnosed based on Rotterdam criteria, which says that 2 out of 3 symptoms are present, then doctors reach a conclusion that a woman is suffering from PCOS. Polycysts, that is more than one cysts that can be found in ultrascan. Second will be irregular menstrual cycles. Third will be excess male hormone testosterone that can be found by blood tests and also facial hair and acne. So if 2 conditions are present out of these 3, generally doctors reach to a conclusion that the woman is suffering from PCOS. PCOS, as the name suggests, is a syndrome. So the exact cause is not known. It can be sometimes lifestyle, it can be genetics, environmental, or a combination of all the factors. 65 to 70% of the women suffering from PCOS are insulin resistant. Now this risk increases if the woman is obese. So what is insulin resistance? Insulin is a hormone that keeps your blood sugar level in check. Now in insulin resistance, what happens is the pancreas secrete insulin, but the body tissues do not react well to the insulin secreted, and that is they don't take in the blood. So due to this, the body creates more and more insulin. And so what does insulin have to do with PCOS? This innocent looking insulin, what it does is whose job is to take blood sugar out and give it to the tissues. What it usually does, it prompts the ovaries to convert estrogen to testosterone, which is a male hormone. All the problems of PCOS are due to this testosterone, like acne, facial hair. So the most important part of this video is how to manage PCOS. Weight loss seems to be the number 1 factor in managing PCOS. High fat percentage increases insulin resistance. So if you lose weight or lose fat, your insulin will become sensitive. And once insulin becomes sensitive, testosterone production stops, so all the other symptoms of PCOS improve. So weight loss should be the number 1 priority when it comes to PCOS. Exercise can make your insulin sensitive, which will help you in decreasing the production of testosterone. So exercise and a good nutrition is of utmost importance in PCOS. Also building muscle should be given a priority because muscle is insulin sensitive, so it can really help you in increasing your metabolism by few calories. Generally prescribed by the doctors to manage diabetes. Since PCOS is a condition of insulin resistance, metformin helps a lot in reducing insulin resistance. It also helps in losing weight, so it's a very good thing for people with PCOS. But generally, do take the suggestion of your doctor before starting it, because it's a prescription medication, and so you should not take it over the counter. Supplement and not a drug, so it does not require a doctor's prescription. You can get it online or from general local medical stores. There are two forms of inositol. It's Mayo and Cairo. All the inositol really has some promising results when it comes to managing all the symptoms of PCOS, including insulin resistance and irregular periods. It is usually prescribed by the doctor so that your period should arrive. See, if you don't get periods for a long period of time, that can even be problematic. So for periods to arrive, doctor usually give this on an urgent basis. It's not a cure for PCOS. So usually women think that once they start taking pill, their periods arrive and everything is normal. No, PCOS does not have a cure yet. It can be managed with lifestyle and other interventions. So lifestyle intervention along with good nutrition and exercise is the number one thing you should do to manage PCOS. Although birth control pills are not useless, though, your doctor will be the best person to make you understand the pros and cons of oral contraceptive pills. In the end, women with PCOS, women suffering from PCOS have a high chances of anxiety and depression. About 40% of the women who suffer from PCOS have depression, while this number is likely to increase due to lifestyle and lack of exercise and other factors. If you liked the video, do subscribe to my channel and leave a comment. Lots of love to you. Thank you.